have the highest rates of disease now that we've seen in a very long time, and I think it's because people are confused about some of the health information. They're not sure what they should do, what they should avoid, what activities to engage in, and I want to help demystify that for people. I'm Dr. Lisa Fitzpatrick with Promoting Practical Health. In my experience, the most effective way to engage people around health issues is face-to-face. We're amidst a flu epidemic, so today we want to just talk to a few people on the street to find out what people actually know about the flu.
I had the flu last month. Yeah.
How'd you get
for
it?
a week. How'd I get it? I don't know, but it knocked me down hard.
How's the flu spread?
Oh, I know how it spread. It's spread because people are germ-ridden and they don't wash their hands and they sneeze and they touch things and then they breathe on you.
Sneezing without covering their mouth.
Not cooking food properly.
That's salmonella.
Well, that's...
Do we think about these devices as maybe portals of...
Well, I'm not worried about my device because it's been in my hand, but I'm worried about the Metro where I grabbed a hold of the rail, you see?
And then put it on the
and
device.
then put it on the device, and then, so there we go, huh?
Drinking other people's drinks.
Drinking other people's drinks, okay.
Handle doors.
Handles on doors, okay.
Not washing your hands.
Not washing your hands. So that was my next question. How do you prevent yourself from getting the flu?
I try not to get it. I had one really bad, and I have to always get the flu shot. I get it every time in September.
Now, have you guys had a flu vaccine?
Yes, I've had flu vaccine.
I think I had it like a year ago.
Get the flu shot, yeah.
You both had the flu
I
shot?
didn't. I never have,
I have.
but
Can't convince him.
she does, but I don't.
Every time I take the flu shot, I get
I
the flu.
took it and I got it.
No,
Okay.
and I don't want one. I see everyone pushing it, and they keep pushing it, and everyone keeps pushing it. I'm sick of corporate America pushing stuff on me.
Yeah. So you think flu shots are... Is that for all shots or just flu shots?
I'd say most all shots.
I'm not an old man. I'm not a young man, but I think a flu shot for me is not really practical. It might be in the future.
So how do you treat it then?
I would drink plenty of fluids, take ibuprofen, get a lot of rest, and wait it out. Hot toddy.
Oh! And what's in a hot toddy?
Some tea and honey and whiskey.
Nice. Okay. So
Are there really home remedies for the flu?
well, I think you really just have to wait it out, unfortunately. Okay, so then let me ask, how do you treat the flu?
That I'm not sure.
And so do you know how to treat the flu? No? So
Never had it.
Have you ever had a cold?
Yeah, I've had a cold.
Okay, well, how do you know it wasn't the flu? What's the difference?
Okay, the flu makes you more tired. Unlike the cold, and
Drowsy.
Drowsy? The flu makes you drowsy?
It makes you ache, right?
fatigue. Yes.
Okay.
The
Can
flu
you...
lasts longer than the cold, doesn't it?
Yeah.
Okay. And what if I gave you antibiotics? Would that help?
It would.
Think so?
Yeah, steroid.
Well, I do that occasionally, you know. I do amoxicillin if you're not, you know. I'll do that occasionally too if I start to feel a sore throat or something, you know.
Yeah.
Is that okay? But
Where do you
your
get-
body can get immune to that, can't it?
That's true, but antibiotics don't treat the flu because the flu's a virus.
There you go.
That's
See,
right.
I knew that.
So that's the kind of
I
stuff
walked
we
right
need to
into
make
that
sure
one, didn't I?
people know.
Yeah. See, I
Yeah,
walked
no,
right
yeah,
into
okay.
that one. Yeah. Okay.
That's quite all right. We're not trying to
Wow.
trick you.
You're not tricking me. Okay.
We're
I'm
just
with
trying
you.
to learn from each other. But how do you think we can get the message out to them?
The way you're talking to me now, each
Right.
one teach one and
Oh.
spread the news.
All right. So today we talked to quite a few people about the flu. And while people clearly understand how flu is spread and what some of the symptoms are of the flu, there was a little bit of confusion about how you prevent the flu and how you treat the flu. So remember, to prevent the flu, always wash your hands after contact with devices or maybe even shaking hands with other people, and avoid touching your face. You can also prevent the flu by getting a flu vaccine. Although the vaccine is not 100% effective, it's still one of the best ways we know to prevent the flu. Regarding treatment, antibiotics do not treat the flu. Antibiotics treat bacteria, and the flu is a virus. The treatment for flu really is to stay home if you're not feeling well, drink lots of fluids, and get plenty of rest. If your symptoms are very severe, you should talk to your healthcare provider about specific treatment for the flu. That's it from Dr. Lisa. We'll see you next time when we're talking to people on the street about communicating with your healthcare provider.